Yes, so we are, we are continuing with the CNS and anti-epileptic drugs. So we had done uh, we had done all of this important drugs, may barbiturates we had done, benzodiazepine, phenytoin we had done all of these, and we had done a carbamazepine and oxcarbazepine. Now we will be doing valproic acid. We'll do it. We'll start. We'll start from here. We'll do it again. Oops. We actually don't need to erase everything. Yeah. So yeah. So valproic acid basically it's a broad spectrum anti-epileptic drug effective in all types of seizures, and it acts by several mechanisms and including the blockade of use dependent sodium channels, increased activity of GABA by increasing the synthesis due to stimulation of glutamic acid decarboxylation. So here's the diagram. Here's the diagram. So glutamate is converted to GABA with the help of glutamic acid decarboxylase. So it increases the activity of that enzyme, right? And decreasing metabolism by inhibiting GABA transaminase, inhibiting T-type calcium channel. So since T-type calcium channel is inhibited, this decrease in release of the glutamate in the brain, and DOC, DOC means drug of choice, and GTCS myoclonic. In fact, every kind of seizure, and it is also effective in Lennox-Gastaut syndrome, absence seizure, infantile spasm, and partial seizure as well. And we had done what was required in the febrile seizure. Febrile seizure may we use the sing benzodiazepines. Here, sorry. So febrile seizures, benzodiazepines are used, and in and with valproic acid, it should be gradually stopped to avoid withdrawal seizures. Other uses of these drugs include bipolar disorder. So it can also be used in bipolar disorders, prophylaxis of migraine, and as an alternative to carb, mm, carbamazepine in trigeminal neuralgia also. Recently, it has been used in tardive dyskinesia, which is involuntary movement of the face and jaw. And it is also a drug of choice for bipolar disorder in patients having rapid cycle. Okay, so every kind of seizure and Lennox-Gastaut syndrome, tonic absent, clonic tonic, and Lennox-Gastaut. Now, valproic acid is a potent microsomal enzyme inhibitor. So we had done like enzyme inducers are GPRS cell phone, and enzyme inhibitors are uh, what was it? Vitamin K deficiency or something. Oh God, how can I forget? And vitamin K cannot cause enzyme inhibition. Yeah. So valproate was there, ketoconazole was there, cimetidine was there, ciprofloxacin, erythromycin, and INH. So vitamin it was vitamin K cannot cause enzyme inhibition. So valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin, and I for INH. isoniazid, right? Now, valproic acid, take enzyme, it's an enzyme inhibitor, right? An adverse effect of this drug includes a weight gain. Weight gain it can cause alopecia. Alopecia is loss of hair, loss of hair, and then tremors, carnitine deficiency, and irreversible hepatic necrosis. So, irreversible hepatic necrosis is one of the things that it causes, and more in children with less than 2 years of age. So, this I can actually use this irreversible hepatic necrosis in less than 2 years of age. And the risk of hepatotoxicity increases when combined with the enzyme induces like carbamazepine, the enzyme induces. So if we are combining the valproic acid, although it is used with it was written right, mm, it is given as an alternative to carbamazepine and trigeminal neuralgia. So it's not given with carbamazepine, but it is given as a substitute. And it cannot be given with enzyme induces when hepatotoxicity is there due to production of hepatotoxic metabolite of valproate. So drug of choice, absolutely a drug of choice for absence issue because no other drug like carbamazepine and all they are not used diazepam, they are not used in the absence issues. Another name for absence seizure is petit mal epilepsy. However, it should be avoided in less than 2 years of age due to risk of irreversible hepatic necrosis. So it was here. Valproate was not given to children below 2 years of age. As absence seizure rarely develops before 5 years of age, so valproate may be considered as a drug of choice for majority of absence seizures. In rare cases, absence seizures in young children, like less than two, if it happens in children less than 2 years of age, then ethosuximide is the drug of choice. Ethosuximide should be given, right? And acute pancreatitis and hyperammonemia. So, hyperammonemia means ammonia is increasing, right? Have been frequently associated with the valproic acid. This is very important. Acute pancreatitis. And if it is used during pregnancy, it can result in neural tube defects in the baby. Neural tube defects in the baby, and it can be prevented with folic acid administration during pregnancy. So, if a pregnant woman is being given this kind of drug, then neural tube deficiency defects can occur in the baby. So, for this reason, and folic acid in general is also responsible for, neural tube formation and protection, and they should be given. It is anyway given. And also, it's associated with the polycystic ovarian disease in girls. Polycystic ovarian disease, which is also a very ठीक है. So there is an adverse effect of valproate. Valproate is vomiting, and then it's alopecia, liver damage. Obviously, hepatotoxicity is there, and hepatic necrosis there if it's given to babies under 2 years of age. Then pancreatitis and PCOD is there. Obviously, pancreatitis, acute pancreatitis. Rash is there, obesity is there, agranulocytosis, tremor, epigastric. These two are very like common ones. But take care. Ethosuximide. Ethosuximide was given for absence seizures under 2 years, no? So they act by inhibiting the T-type calcium channels. Every almost every drug is doing that. Only for absence seizures for children less than 2 years of age. Ethosuximide and methodione. So trimethadione is more toxic than ethosuximide and is therefore no longer used. Characteristic adverse effect of trimethadione is hemarlopia, which is photophobia or glare effect. It's a very hemarlopia. Okay, Google, what is hemarlopia? I don't know. It won't be able to. It won't know. It won't recognize. I'm really sorry. What is hemarlopia? Uh, okay.
According to NCBI, hemerolopia is a word that originated in the 18th century, which means day blindness, or visual defect characterized by the inability to see as clearly in bright light as in dim light.
Hmm. So it's photophobia or glare effect. Like people, they are not able to. They can't see effectively. Let me write it only. Can't see effectively in daylight as light. Okay. Now another anti-epileptic drug is vigabatrin. Vigabatrin we had run like inhibits the GABA transaminase. Therefore, uh, it helps in it actually inhibits the metabolism of GABA. So it inhibits the GABA transaminase. Thus the GABA is not metabolized and it increases the activity of the GABAergic drugs or GABA. It's a DOC for infantile spasm associated with tuberous sclerosis. Vigabatrin, no? For tuberous sclerosis, it can be given with infantile spasm. तो लिखा ही हुआ है. Just and ACTH is DOC for all of the cases. Hmm. It can result in irreversible visual field effect due to retinal atrophy. The retinal atrophy can also occur with vigabatrin. Now, and they have given कि क्या क्या हो सकता है. तो vigabatrin, this whole is actually vigabatrin. Um, it's it's क्या बोलते हैं, it's been cut into pieces. Like हिंदी में तो छंदी छेद बोलते हैं ना. I don't know what it's called in English. So Y is for visual field effect. GABA is GABA only. TR is for transaminase because GABA transaminase is acting on GABA to metabolize it, to break it down. So that's the mechanism of action only. And transaminase visual field effect होता है GABA transaminase inhibitor. So that way you can learn. Lamotrigine, there are other drugs as well. It's a broad spectrum anti-epileptic drug useful for various seizures, including absent and myoclonic epilepsy. It is specifically indicated for depressive phase of manic depressive. So they're actually saying depressive phase of the manic depressive psychosis means key it's basically a bipolar disorder only. Bipolar disorder. So what happens in that is there are two phases. One is manic phase and one is depressive phase. Depressive phase is very like the person is very depressed, like he's low and he's having depressive thoughts about everything. In manic episodes, they do not experience any depression. They are very um, irrationally very positive about everything, and they think that if they'll do anything, it will just it will just be, and there won't be any consequences. I mean, um, So those are the manic episodes. And Steven Johnson syndrome. Steven Johnson are TENS, like SJS and TENS, and they're the important adverse effect of the lamotrigine as well. Yeah. Now gabapentin, it's an inhibitory presynaptic calcium channel by binding to the alpha 2 GABA delta 1 subunit. Its absorption from GIT is saturable, therefore it is safe even after overdosing. So gabapentin is okay with overdosing. Its absorption from GIT is saturable. So it is useful in GTCs and partial seizure. Non-epileptic uses include diabetic and post-herpetic neuralgia. So diabetes and post-herpetic neuralgia में देते हैं obviously. And UC for both of these conditions, the pain associated with multiple sclerosis also. It's okay. Gabapentin is a good drug. Similar to gabapentin is pregabalin also. Now, ganaxolone is a neurosteroid. It is synthesized in the brain. Synthesized ganaxolone, it's a neurosteroid and it's synthesized in the brain. It's effective for absence seizure, infantile spasm. कौन सा drug था vigabatrin only ना infantile spasm, absence seizure and catamenial epilepsy. Oh, catamenial. Seizures occurring during menstruation. Catamenial बोलते हैं उसको. Honestly, I had no idea. Okay, where's my phone? Okay, Google. What is catamenial epilepsy?
According to Cedars-Sinai, catamenial epilepsy, also known as menstrual seizures, is linked to a woman's menstrual cycle and related hormone levels in the body. Women with CE often have more seizures during certain times of their cycle.
Hmm. So at specific point, they're obviously, I'm not sure if they're related to hormone levels. There are a lot of things in the body that is unknown. So yeah, they has to be they have to be acting on the brain, some brain tissue like to cause seizure and hormone levels. I don't know. Catamenial epilepsy seizures occurring during menstruation. Topiramate, they act by blocking the sodium channel. They act by blocking the sodium channels, increasing the GABA transmission, inhibiting kainate receptors. So they are increasing the GABA transmission and they are also inhibiting the kainate receptors. They have to be inhibited. Kainate receptors are something I read before. Let me see. It was here. कुछ तो थे बहुत सारे receptors होते हैं. Cheese reaction is तो hypertensive crisis में होता है. Mao. There were a lot of receptors. Like one of them was kainate receptors as well. I remember. Kainate receptors होते हैं. Mm. It is useful in GTC as partial seizure and Lennox-Gastaut syndrome. It can cause weight loss. And zonisamide, another epileptic drug, and topiramate can cause renal stone as well. So renal stone due to their carbonic anhydrase inhibitory activity. Zonisamide. and topiramate. Another okay, felbamate is an NMDA blocker and is useful in drug-resistant epilepsies, but its use is limited due to hepatotoxic and aplastic anemia. So hepatotoxicity and aplastic anemia is felbamate. Param is a new selective AMP type glutamate receptor antagonist and is indicated for focal seizures. And levetiracetam and brivaracetam and levetiracetam are anti-epileptic drugs used for the focal seizures. These modify synaptic release of GABA and glutamate by binding to synaptic vesicular protein S2VA. SV2A. SV2A. This is a vesicular protein, synaptic vesicular protein. तो उससे bind हो जाते हैं these drugs and they modify the synaptic release of GABA and glutamate. So, and these drugs can cause CNS adverse effects like irritability, aggression, and liability of the mood. Mm. Magnesium sulfate is used for treating the convulsions during labor. Its toxicity is monitored by patellar reflex knee. Very weird drugs, levetiracetam and brivaracetam. Magnesium sulfate is a drug of choice for eclampsia during labor, and this toxicity is monitored by patellar reflex. It's a weird one. So somebody who's pregnant, we have to check the patellar reflex. If it's not there, knee jerk is not there, that means magnesium sulfate has reached its toxicity level. Also, tigerbalm is indicated for adjunctive treatment of partial seizure. It is rationally designed drug as an inhibitor of GABA uptake by inhibiting what? GAD1. Lacosamide is a recently approved drug for the adjunctive therapy of partial onset seizure. It acts by blocking sodium channel and CRMP2. Sodium channels. CRMP is collapsin response mediator protein. So it's a full form. Collapsin response mediator protein 2. Sodium channels are also blocked. Now, blockade of CRMP2 results in stopping the effect of neurotropic factors like BDNF and NT3, like zonal and dendritic growth. Stiripentol is a new oral anti-epileptic drug. It increases GABAergic activity and it has recently been approved for treatment of Dravet syndrome. What's Dravet syndrome? नहीं लिखा है क्या? Okay, Google. What is Dravet syndrome?
According to National Institute of Neurological Disorders and Stroke, Dravet syndrome, previously called severe myoclonic epilepsy of infancy, is an epilepsy syndrome that begins in infancy or early childhood and can include a spectrum of symptoms ranging from mild to severe.
Okay, so epilepsy that begins in the childhood. Ouch. Epilepsy that begins in childhood. That is the meaning of it. Hmm. पता होगा। अच्छा अभी ओके सो propagated action potential so ये कैसे काम करता है mechanism of action of non-epileptic drugs तो they are being shown 3 नहीं पाएगा so propagated यहाँ पे आया सोडियम चैनल से getting यहाँ आ रहे हैं so voltage gated सोडियम चैनल को ब्लॉक कौन करता है it's phenytoin carbamazepine oxcarbazepine acetylcarbazepine acetate lamotrigine lacosamide and zonisamide zonisamide with topiramate uh, caused renal stones no zonisamide yeah so that now levetiracetam something else एक और था that was हाँ तो वेसिकुलर प्रोटीन को पे अटैच होते थे those drugs they attach and they modify vesic they modify the release they modify the synaptic release of the GABA and this thing ये भी हो गया now now reticabine actually what it does is calcium potassium channel को वो करता है ब्लॉक कर गाबापेंटिन एंड प्रीगाबलिन इसका अल्फा 2 डेल्टा 1 सब यूनिट को यूनिट ऑफ द कैल्शियम चैनल यहाँ पे एक्ट करता है एंड इट इनहिबिट्स calcium intake tigerbalm acts on the GAT also inhibits glial GAT benzodiazepine barbiturates obviously they act on the this GABA benzodiazepine chloride channels perampanel they act on यहाँ पे था perampanel they act on the AMP type glutamate receptor AMP type glutamate receptor पे act करते हैं perampanel and again reticabine potassium channel ethosuximide calcium T type calcium channel tubules पे act करता है glutamate they act on ये तो glutamate है ही that releases glutamate अच्छा तो ये glutamate के लिए थे and these are for GABA got it now rafinamide is another recently approved drug for the adjunctive treatment of the seizures associated with Lennox-Gastaut syndrome thought to be inhibiting the sodium channel rafinamide यहाँ पे नहीं दिया and reticabine also reticabine I think I read it ये रहा reticabine approved for add-on of partial seizures in adult unit retention is its major retention होता है major adverse effect cannabidiol is a CB1 receptor agonist. It is recently approved for Lennox-Gastaut syndrome and Dravet syndrome. Dravet syndrome, though, something that occurs starts in the infancy. It's a drug approved for FDA containing purified marijuana derivative. तो इसमें obviously cannabidiol इसमें marijuana यूज होता है